Medicaid agencies on state plan amendment submission and processing. My name is Gilson da Silva, and I will be one of your presenters today. We do want to remind you to please be on mute. For other presenters, with me today are Carrie Toback, Karen Hatcher, and Michaela Walker. Ford Blunt is also providing support for our training today. In this introduction, we want to mention that this training relates only to submission of Medicaid SPAs, SPAs being state plan amendments. And this training does not cover CHIP state plan submissions, CHIP being the Children's Health Insurance Program. CHIP state plan submissions are a separate process. As you can see in this slide, each state and territory is required to have a Medicaid state plan that documents who is eligible, what services are covered, and how the state will reimburse providers. To make changes to a state plan, states submit a state plan amendment, or SPA, as I mentioned, to CMS for approval. The Center for Medicaid and CHIP Services, or CMCS, developed this training to help our state partners understand the SPA submission requirements and submission process. Again, this training focuses on the SPA submission process, and we will not delve into the policy behind SPAs. CMCS hopes to develop additional training sessions in the future where policy topics will be discussed. We hope to leave plenty of time at the end for questions and answers. However, as we proceed, please feel free to enter questions into the chat function. And also, please refrain from answering questions in the chat, but please allow the CMS staff to respond. For our topics today, for the topics that we'll be covering in today's training, as you see, we'll be covering the state plan structure, the SPA processing overview, the SPA submission packages, including public notice and tribal consultation. We will talk about completing the CMS 179 form, effective date requirements, CMS review team roles, and also we'll be covering the SPA submission systems. For our first topic, covering the Medicaid state plan structure, this slide is showing you the 9 sections of a state plan. Many of the sections are self-explanatory. Section 1, single state agency, describes the state Medicaid agency and its organization. Section 2, eligibility, describes those who are eligible. Section 3, coverage, describes covered services. Now, the details of how services are reimbursed are in Section 4, the General Program Administration. And in Section 4, we also find information on reimbursement, hearings and appeals, maintaining records, preventing fraud, and other topics. Sections 5 and 6 describe state Medicaid agency personnel and how the state will collect federal financial participation. There is also a Section 7.4 for disaster relief SPAs, Section 8 for modified adjusted gross income, or MAGI SPAs, and Section 9 for Medicaid and CHIP program SPAs, or MACPRO SPAs. Later in this training, we will talk about the SPA submission systems, as I had mentioned. Besides OneMac and MACPRO, the Medicaid Model Data Lab, or MMDL, is the third system CMS uses to process SPAs. MMDL SPAs go into Section 3, Section 4, or Section 8, depending on their content. Also, in the embedded document in this slide, which was published in November of 2019, can be double-clicked for a more detailed view. Since this table of contents was produced, many parts of Section 2 have moved to Section 9 to MACPRO SPAs and are no longer found in Section 2. Also, there were many additions to mandatory Medicaid benefits from 2020 through 2022 that are not reflected in the table of contents. We want to be sure our intent in sharing this document is clear. This is just an aid to locating where information might be in the state plan, but states are not required to have a table of contents in their state plan. A SPA submission is required anytime a change is being requested or needed to the state plan. There are many factors which may lead to a SPA submission, such as changes to state law, changes to federal law, and updates to state operations for items like reimbursement changes. Next slide. Now covering the SPA processing overview. The SPA processing starts with CMS staff review of the submission for compliance with statutory and regulatory requirements. CMS staff may have questions after their initial review of the submission and may provide technical assistance to the state. In turn, the state staff provide responses to CMS questions and revise documents. This cycle may happen multiple times before the final version of the SPA is compliant with relevant statutes and regulations. Now, the bottom half of this slide notes a specific event in the SPA review process, which is called the 15-day call. Upon submission of the SPA, the CMS review team offers to schedule an introductory call to allow the state to provide an overview of the submission and any critical timelines. This call simplifies the initial CMS review, allows CMS to communicate any areas of incomplete information, and identify major policy issues, which can help shorten processing time. Still continuing with our SPA processing overview, CMS must approve, disapprove, or request additional information on a SPA within 90 days of submission, or the amendment is deemed approved. For Medicaid, the 90-day time period can be stopped only once by a formal written request for additional information, which we call RAI, an RAI from CMS. Upon receipt of the formal RAI response from the state, a new 90-day clock is initiated. Now, all three SPA submission systems, being OneMac, Mac Pro, and MMDL, as we will review them later, include functionality to withdraw SPAs. A best practice for states to also send an email to the CPOC, CPOC being the CMS point of contact, which is usually your state lead, and to this email address, to spa@cms.hhs.gov, stating that you wish to withdraw the SPA. Again, the best practice for states who are desiring to withdraw a SPA is to send an email to your state lead, to your CPOC, and to SPA or spa@cms.hhs.gov. You should send the email on the same day as you complete the withdrawal in the relevant system to ensure that the dates are aligned across all systems. And to give you a graphic demonstration of the progression of the 90-day clock, we would like to go over this slide. Once a state submits the SPA, the first 90-day clock begins. The 15-day call takes place if needed. If the state would like to request one, the state staff provide a high-level overview of the SPA and then informal questions and responses are typically sent during this period. When there is sufficient information to approve a SPA during the first 90-day clock, no RAI or request for additional information is issued, and there is no second clock. And then the next step is simply for CMS to approve the SPA. However, if there are issues for the approval of the SPA during the first 90-day clock, CMS will then issue an RAI, a request for additional information, and that places the SPA off the clock, as you see on the slide. The 90-day clock stops the day that CMS issues the RAI. The second 90-day clock will begin once the state submits the responses to the RAI, to the request for additional information. The second 90-day clock starts the day that the state submits those responses to the RAI. And hopefully by the end of that second 90-day clock, or even before, the SPA will then be approved. And so now let me turn it over to my colleague, Carrie Toback, who will be speaking about the SPA submission packages. Carrie?
Gilson, thank you. We're going to talk about the SPA submission packages. SPA submission packages look different depending on the submission type and the submission system being used. All SPA packages start with the CMS 179 submission form and the SPA pages as a foundation of the SPA, regardless of the system. For the three submission systems currently used, these foundational documents have slightly different names. First, an MMDL The summary submission form serves as the CMS 179, and the SPA pages are in PDF form. They can be located in the ABP and cost-sharing MMDL modules under PDF forms. These documents are then loaded into MMDL as a new SPA. In MacPro, you'll find these submission package pieces in the Submission Summary Reviewable Unit, or RU, built within the system, and additional RUs for the SPA pages. All the documents for a macro SPA are housed within the system. And finally, for SPAs submitted in OneMac, the submission uses what we call the paper-based CMS 179 form and paper-based SPA pages. These forms and pages are attached to the SPA record created within OneMac. The most current version of the paper-based CMS 179 form can be found on Medicaid.gov under State Resources /Medicaid SPA Toolkit. Depending on the submission type or the topic of the SPA, there could be additional documentation requirements that would be required as part of a complete submission package. Some SPAs require public notice, and evidence of that notice is required as part of the SPA submission. If the state has federally recognized tribes, tribal notice may be required, and evidence of that notice would need to be submitted with the SPA. Some other document types that could be required to be submitted with the SPA include information on fiscal impact, demonstrations, or UPL guidance documents supplied with UPLs for certain types of reimbursement SPAs. Many states also submit a cover letter, but cover letters are not required. Next slide. Let's spend a few minutes on public notice requirements. Some SPAs do not require public notice. Those would include some coverage SPAs and some eligibility SPAs. There are three types of SPAs that require public notice. One, SPAs that enact changes to the methods and standards for reimbursement. Two, SPAs impacting Medicaid premiums and cost sharing. And three, SPAs that establish or modify an alternative benefit plan. Please note that each of these three types of notice have different requirements, which are outlined within the applicable federal regulation noted on this slide. We'll cover these requirements in more detail later in the presentation. If you are ever in doubt if notice is required, you can reach out to your CMS state lead. Next slide. It's important to understand the nuances of the public notice requirements in order to make sure that the timing of the notice does not negatively impact the state's intentions for the effective date of a SPA. Therefore, one of the most important considerations as you are in the early stages of developing a state plan package is to know if public notice is required and how the required timing of notice could impact your effective date. It is important to ensure public notice is conducted timely and accurately to be able to secure a desired effective date for a SPA. Problems with public notice can result in an approval problem for a requested approval date. CMS has issued guidance to states on the federal public notice requirements for reimbursement SPAs. This is an important document to review to ensure compliance with not only the timing, but the content of these notices. If you have questions regarding public notice, please consult with your state lead or your CMS point of contact, CPOC. The CPOC role will be discussed a little bit more later in the presentation. More details of the relationship between public notice and effective dates will also be covered later in the presentation. It's important to understand which public notice requirements apply to each particular SPA in order to secure the desired effective date. Next slide. In addition to public notice requirements, states with federally recognized tribes or states with Indian healthcare providers located within their states must also comply with the tribal consultation requirements that can be found in Section 1902A73 of the Social Security Act, 42 CFR 431.408, and SMDL 124. All states with federally recognized tribes and Indian health providers must have a formally approved tribal consultation process in its state plan. This state plan page describes the state's process for soliciting advice prior to submissions on matters that have direct impact on Indians, Indian health programs, or urban Indian organizations. Relevant submissions include Medicaid SPAs, 1915 waivers, CHIP programs, and 1115 demonstrations. All states that consult with tribes should already have an approved tribal consultation consultation SPA, which contains a description of the state's consultation process, and it can likely be found in Section 1 Administration. Most consultation processes are located in Section 1.4. However, a few states have their consultation processes in another location in Section 1. It's very important for states to be familiar with and execute the tribal consultation requirements in their own state plan correctly. Tribal consultation that doesn't meet the state plan requirements will have to be redone, which can jeopardize the desired effective date for a SPA. As we noted before, states must include the documentation of that tribal consultation completed in accordance with its own tribal consultation policy in the SPA submission package when it's required. Our next slide shares an example of one state's tribal consultation process and its tribal consultation policy documents. Please note that this is an example of one state's process. Each state should follow the tribal process outlined in its own state, for its own state. Our example shares the approved tribal consultation page from the actual state plan and of the tribal consultation documentation submitted for an actual SPA. On this slide, we are sharing one state's tribal consultation policy within the state plan. Please note that the state plan that this state consulted with their tribes in the development of this consultation policy and then submitted the SPA for approval by CMS. Each state with tribes has its own consultation policy in its state plan. On the left side of the slide, you can see the page of the state plan that describes this state's tribal consultation requirements that are approved in their own state plan. For this state, the underlined paragraph details that the state Medicaid agency issues a letter to each ITU provider advising them of proposed SPAs and encouraging them to offer feedback. These letters are also posted to the state's public website, which offers another way for tribes and tribal providers to submit feedback. Notification to tribes has to be provided at least 60 days prior to the SPA submission for this state. Your state may have different timeframes for consultation and SPA submissions. In abnormal circumstances, the consultation period can be shortened to as few as 14 days, but as much notice as possible should be given. Once again, each state with tribes has their own tribal consultation policy within the state plan. Each state's tribal consultation policy is located in Section 1 preprints of the Medicaid State Plan. Please consult this section of your state plan to ensure your state is following its approved consultation process. The document on the right is an example of what a state submitted to CMS as part of a SPA package that shows the consultation the state conducted in accordance with its approved tribal consultation process. Here we have the tribal consultation that the example state submitted with an actual SPA on October 5th, 2020. Since the date of the letter to the tribes is February 13th, 2020, the 60-day consultation requirement for this state was met. The letter also includes information on the proposed SPA, outlines the date of the next tribal consultation meeting, invites feedback, and describes the way that feedback may be submitted. Other documents included here are the agendas of the tribal consultation meetings at which the SPA was discussed. Please remember that each state's consultation process differs, and we are just sharing one example from one state. These documents are provided as examples of successful tribal consultation. States should not simply replicate the processes illustrated here, but rather follow the process described in their own approved state plans. Understanding and executing the requirements of your own state plan is key to meeting the tribal consultation requirements. Next slide. Let's talk briefly about submission requirements for reimbursement SPAs. These SPAs detail the reimbursement for state plan services and can typically be found in attachment 419A and 419D for institutional services and in 419B for outpatient services. While submitting reimbursement SPAs, a state must include answers to the applicable funding questions. Please note that there are different funding questions for institutional and non-institutional SPAs. There are many useful tools for reimbursement SPAs on Medicaid.gov under the Medicaid section on the dark blue banner using the link to financial management. CMCS is hoping to provide further training on to states on reimbursement SPAs later this year. Now that we know what the submission requirements are for different SPAs, let's take a closer look at the specific pieces of the actual submissions, starting with the CMS 179 or also the SPA submission form. The CMS 179 form provides pertinent information pertaining to the SPA submission. Information on the 179 includes dates of submission, the purpose of the SPA, fiscal impact of the SPA, and which pages are being submitted, modified, or removed as part of the proposed amendment. Please note that sometimes in the course of reviewing a SPA, CMS finds that changes or corrections are needed to be made to the 179 form. This can be a result of errors or, more likely, changes to the amendment that result from review and collaborative work between CMS and the state. When changes are necessary, CMS can ask the state staff for permission to make what we call a pen and ink change. This is a way for CMS to make changes to the 179 rather than having to ask state staff to revise the 179, have it re-signed, and then resubmitted. On our next slide, we're going to highlight a few areas where most of the pen and ink changes occur. Here is an example of some sections of the CMS 179 form. Box 5. This box should cite the relevant statute or regulation relevant to the subject matter of the SPA. In this case, we're referencing the Social Security Act 1902A-20 or 42 CFR 43110. In box 6, the federal fiscal impact is given in whole dollars. It used to be thousands of dollars, but now it's whole dollars, and should only reflect fee-for-service expenditures. So if your state has both managed care and fee-for-service delivery systems, the numbers on the CMS 179 will only reflect those costs associated with the fee-for-service delivery system. Box 7. Every page of the state plan that is being amended or created should be listed in box 7. It is okay to give ranges of contiguous pages, such as attachment 3.1A, pages 5 through 10, as long as every page of 5 through 10 in the range is being amended. Box 8. Similarly, every page of the state plan that is being deleted or amended should be listed in box 8. Ranges are okay if every page is being replaced. If submitted pages are new, they would not be listed in box 8. Also, if pages are being permanently deleted and not replaced from the state plan, they'll only appear in box 8. Box 9. This is where the state concisely explains the subject matter of the SPA submission. The example on the screen indicates the state is adding tobacco cessation as a new service. As you can see, box 9 concisely describes the action being taken with this SPA. Our next slide shows page 2 of the CMS 179 form. This is an instruction page on how to complete the CMS 179 form and does not need to be included with the SPA submission. As promised earlier, now we're going to talk more in depth about effective dates. As we recently learned during the COVID emergency, it is possible to waive the normal effective date rules during a declared public health emergency with an 1135 waiver. But under normal circumstances, the regulations that govern SPA effective dates can be located in sections 42 CFR 430.20 and 42 CFR 447.256. For payment SPAs, public notice needs to occur prior to the effective date, but the SPA does not need to be held for submission for the comment period. However, please note that if states decide to make changes to the SPA pages as a result of public comment, revised SPA pages would need to be submitted. In contrast, for institutional reimbursement SPAs, timing of public notice is more critical. States will follow a public process that is outlined in 1903A-13A of the Social Security Act. For reimbursement SPAs, the earliest possible effective date is the day after public notice or the first day of the quarter the SPA is submitted, whichever is the later date. This slide walks through how the requested effective dates relates to the timing of the public notice and SPA submission. The first example shows that SPAs submitted from January 1 up through March 31st, which is the first quarter of the year, can have an effective date as early as January 1st. If public notice was required for the SPA submission and the state did not conduct public notice until January 1st, then the earliest the effective date could possibly be would be January 2nd. Now, if the state had conducted notice on or before December 31st of the prior year, then the state could request that effective date of January 1st as shown in the first bullet. If you have additional questions regarding public notice for reimbursement SPAs, please refer to 42 CFR 447-205 or reach out to your state reimbursement lead. Next slide. Some SPAs require public notice to be conducted prior to the submission of the SPA. For SPAs that make significant changes to premiums and cost sharings, or SPAs that make changes to ABPs, states must provide the public with advance notice and a reasonable opportunity to comment. Therefore, for cost sharing and ABP SPAs, states must complete both the public notice and the comment period prior to submitting the SPA. When the cost sharing or ABP SPA is submitted to CMS, the submission should include documentation of notice and information relating to comments. When the SPA is being reviewed, if there are substantial changes made to the submitted SPA pages, there is a possibility that states may need to provide additional notice. If states have questions regarding the reasonable opportunity rule, please ask your state lead for help. The general rule about effective dates from our previous slide also applies to these types of SPAs. Please note that bullet 3 draws attention to where you can find special requirements relating to the content of public notice for these SPAs. It is always best for states to reference the regulations highlighted in this bullet. It is important for states to meet these special requirements to be able to implement approved SPAs on the proposed effective dates. Let's shift gears and talk about CMS SPA review team. The Centers for Medicare and CHIP Services, or CMCS, Medicaid and CHIP Services, or CMCS, is responsible for the policy development, operations, and oversight for the Medicaid and CHIP programs. CMCS is one of many centers within CMS, and then CMCS is further organized into groups and divisions. SPAs are reviewed by various groups or divisions depending on the content of the SPA. Cross-cutting SPAs are reviewed by a team of subject matter experts drawn from these different CMCS groups. All SPAs submitted to CMS are assigned a CMS point of contact and a review team. The CPOC, or CMS point of contact, serves as the main point of contact for SPA reviews and serves as the liaison between the state and the review team. The review team is comprised of subject matter experts across different CMCS teams. The person assigned as the CPOC role will depend on the subject matter of the SPA. Next slide. The person who reaches out to schedule the 15-day call is almost always the CPOC. If the person setting up the 15-day call is not the CPOC, typically the state will be told who is the CPOC during that 15-day call. For efficiency, states should direct questions regarding a SPA directly to the CPOC. For disaster recovery SPAs, coverage SPAs, dual component SPAs, which are SPAs that include both reimbursement and coverage pages, for eligibility SPAs, and a few other types of SPAs, the CPOC will most likely be the state lead. For SPAs that only update reimbursement, the CPOC will likely be someone from the Division of Reimbursement Review. Please note there are a few times when a CPOC could change in mid-review. The most common times this happens are when either 1, a current CPOC becomes unavailable to complete the review, or 2, when during the review process, pages are removed from the SPA and the current CPOC will no longer be involved with the review. For example, this can happen when coverage pages are removed and only reimbursement pages remain. In that case, the CPOC would change from the state lead to someone from the Division of Reimbursement Review. There are a couple of other SPA types for which the CPOC will likely be a subject matter expert from the division related to that subject area of the SPA. For example, for a pharmacy SPA submitted, the CPOC will be from the Division of Pharmacy. This would pertain to SPAs typically with SPA pages attachment 3.1a, item 12a, and 419, item 12a. For managed care SPAs with SPA pages from attachment 3.1f and PACE SPAs, the CPOC will most likely be from the Division of Managed Care in the Managed Care Group. For 1915I, J, and K SPAs, the CPOC will be from the Division of HCBS Operations with the Medicaid and CHIP Operations Group in the MCOG. So to reiterate, there are several different staff personnel who could be your CPOC. The individual from CMS who reaches out regarding the 15-day call call is most likely the CPOC, and if not, typically the CPOC will let you know during the 15-day call. We will now turn the presentation over to Karen Hatcher and Michaela Walker, who will be walking us through the different SPA submission systems.
Hi, thank you, Carrie. We just want to quickly remind everyone, please make sure your phones are muted as we're getting a lot of background noise as the presentation is going on. Thank you. Now, currently there are 3 SPA submission systems, OneMac, Mac Pro, and the Medicaid Model Data Lab, better known as MMDL. Most SPAs are submitted through OneMac. Any SPA that does not fit the criteria for Mac Pro or MMDL, which we'll discuss momentarily, should be submitted via OneMac. For many years, CMCS used an email-based system for most SPAs with a mailbox for each CMCS regional office. As of February 1, 2022, OneMac replaced the email-based submission system. The regional mailboxes have been closed and states are no longer able to use them for SPA submissions. If you attempt to send an email to the old SPA mailboxes, you should receive a bounce back stating the message has not been delivered. Paper-based is a way of describing SPAs that are formatted like they were still on paper pages in a physical document. It's also a way of referring to SPAs not processed through Mac Pro or MMDL, even though MMDL forms are formatted to fit on a physical page. MMDL is a web-based submission system used to submit premium and cost-sharing SPAs and alternative benefit plan SPAs known as ABPs. There are 2 kinds of premium and cost-sharing SPAs. Those related to states' assurances of compliance with limits on cost-sharing and premiums, and those that make changes to the amounts or methodologies around premiums and cost-sharing. The first type of cost-sharing SPAs relate to assurances are submitted via MMDL. SPAs that change the information about the amounts or methodologies around premiums are submitted via OneMac. The MMDL system contains fillable PDFs. The states can download from the system and submit via the MMDL system. There are also useful implementation guides available to assist with completing the MMDL modules. You do not need to be logged into MMDL to access the PDF files or guides. For MMDL SPAs, only the SPA documents themselves are submitted in the system. All other communications regarding MMDL SPAs, such as informal questions, are sent and received by email. Formal RAIs for MMDL are sent to states via email. However, RAI responses for MMDL SPAs are submitted via OneMac. For ABP SPAs, states will create a new MMDL record for the initial submission of a new ABP group. Once approved, all amendments to the approved ABP SPA will be submitted as amendments to the original MMDL record. Cost-sharing SPAs are handled differently. Every time a state would like to update the cost-sharing assurances, states will create a new MMDL record for the SPA. An MMDL training with more details on using the system and when to submit an amendment versus when to create a new record is being developed. Let's do a quick demo of MMDL itself. On the MMDL screen shown here, you'll notice that there are 2 main sections. There are 2 main sections. We're concentrating today on the right hand of the screen. That's labeled PDF repository. There are a number of subsections. The first subsection is for the Medicaid State Plan eligibility. These type of eligibility SPAs are submitted via Mac Pro now. So we're not going to spend time on the old MMDL eligibility forms today. If you click on this eligibility section, you'll see a red warning about how these SPAs are now submitted through Mac Pro. The next subsection is for CHIP eligibility SPAs. Since this presentation is on Medicaid SPAs, we're going to skip that one as well. The next 2 sections are focused on Medicaid alternative benefit plans and Medicaid premiums and cost sharing. This is where you'll find the access modules, forms and implementation guides to these type of SPAs. It might be noted that there is a subsection for health homes on the left side of the screen. The Access module link there works, but doesn't actually take you to any information since health home spas are now also submitted via Mac Pro. When you click on either the ABP or Medicaid costs sharing access module links, you'll see a list of spas for the spa type submitted by states. This image is of the premium cost sharing access module. The ABP access module screen looks very similar if we had chosen that link. This image was generated in a test environment. If we're looking at the production MDL environment, all the ZZ abbreviations would be actual state abbreviations. By clicking on the active for any spas on the list, you can access the current documents and take actions on pending spas, like submissions, withdrawals, etc. Clicking on the detail for any spa in the list, you can see a historical submission for the pending spas packages and can take actions associated with any pending submission, such as submission or withdrawals, etc. The detail list will also show all amendments to an MMDL record. This is for APP spas only. If we had clicked on the active link for any spa on the Access module screen, this is what the next screen would look like. You can see the links to take actions such as browsing the pages, editing the pages, printing the pages, and submitting or withdrawing the package. Back to the home screen, which is, if you'd like to refer to later, is on slide 27. We saw how there is a link to PDF forms under the premium cost sharing and ABP headings. Clicking on the PDF forms links takes you to a list of links to the PDF templates for the relevant spa type. This image shows what the screen looks like for premium and cost sharing. However, the screens for ABP forms look very similar. This is where you can look at and download the templates to review and understand what information is required to complete them, and to also complete them for an actual submission. Back to the home screen, we saw how there are links to the implementation guide under the premium and cost sharing and ABP headings. Clicking the implementation guide link will take you to a list of links to the implementation guides for the relevant spa types. There's an implementation guide for each PDF form. This image shows what the screen looks like for the premium and cost sharing, but the screen for ABP implementation guides looks very similar. These documents provide detailed background information on each of the PDF templates, including the criteria CMS uses to review them. Next, we're going to pass the presentation to Michaela to take a look at the MacPro system.
Thank you, Karen. So as Karen just noted, I'm going to talk to us about the second of our 3 SPA submission systems. The one that we're focusing on in these next few minutes is called MacPro. MacPro is a web-based application for the submission, review, and disposition of 3 types of SPAs. SPAs related to administration, eligibility, and health homes. Instead of SPA pages, MacPro contains reviewable units, or RUs, with structured data forms. All SPA-related actions for MacPro SPAs are conducted in the system, including the issuance of CMS requests for clarification and state responses to those requests, revisions to the reviewable units, the issuance of formal RAIs and states' formal responses to those RAIs, and draft SPA submissions. In most cases, a MacPro RU only addresses a single topic, and it's more structured in format than the paper-based SPA pages. The more structured data allows for easier identification of information than in the paper-based state plan. For example, there's a MacPro RU titled Medically Needy Income Level that's used to describe the income standard for medically needy eligibility. In the paper-based state plan, this information was in attachment 2.6, and it was typically spread across multiple pages, which also contained other types of eligibility information. In MacPro, all of that information is gathered in this one RU, and this one RU only contains information related to the medically needy income level. As I mentioned just a moment ago, MacPro does also include functionality for submitting a draft SPA. I want to make sure it's clear that submitting a draft SPA does not start the 90-day review clock, and it does not help a state predict an effective date. So state users should be mindful of whether they're selecting a draft or an official submission option when they're setting up a new MacPro SPA. Next, we're going to take a look at some screenshots of what MacPro actually looks like. So after you log into MacPro, there'll be a menu across the top of the screen with the options News, Tasks, Records, Reports, and Actions. The Actions menu is where you can create new SPAs. After clicking on Actions, you would look for the Create Submission Packages link. The first screen that comes up after you click the Create Submission Packages link will be the submission summary. This is the MacPro equivalent of the CMS 179. Once the submission summary is completed, validated, and saved, you can select the next RU to work on from the Navigate to Reviewable Unit drop-down menu that's in the lower right corner of the screen. Every SPA package automatically includes the RUs for public comment and travel input, as well as the Medicaid State Plan RU. So you would select the RU that you want to work on next from that drop-down menu in the lower right corner, and then click the blue Go to Selected Reviewable Unit button. The Medicaid State Plan RU is where you can select the other reviewable units to include in the package, which depends on the content of the SPA. You would select the administration checkbox for SPAs related to the single state agency. You would select the eligibility checkbox for SPAs related to eligibility, and you would select the benefits and payments checkbox for health home SPAs. This is a base concept for navigating MacPro that many new users have trouble grasping. Most people expect the functionality for selecting RUs to be built into the MacPro user interface. But in MacPro, you use the Medicaid State Plan RU to select additional RUs to put in the SPA package. If we had put a check in the administration checkbox, we would see these additional levels of checkboxes open up that are illustrated in the screenshot. The rightmost column lists the RUs that can be selected to add to the SPA. They're arranged under a subheading of organization that's automatically selected since it's the only subheading available in this list. If we had put a check in the eligibility checkbox, again, we would see additional levels of checkboxes open up. And again, the rightmost column lists the RUs that can be selected to add to the SPA. Since there are lots of RUs related to eligibility, these are arranged under several subheadings. Those subheadings are income and resource methodologies, income and resource standards, mandatory eligibility groups, optional eligibility groups, non-financial eligibility, and eligibility and enrollment processes. Selecting any of those subheadings opens up the third column that contains the RUs in that group. Finally, if we had put a check in the health homes checkbox, the two health homes RUs would open up. Since there are only two health homes RUs, there are no subheadings and there's only one additional column instead of two, like we saw with the two previous groups. The two health homes RUs are for a regular health home SPA and a 1945A health home SPA. So if your goal was to work on a SPA package that already exists in MacPro, after you log in, you would click on the Records menu near the top of the screen, and then click on the button that's labeled Submission Packages, Your State. After you do that, a list of all the existing packages created by users from your state will appear. you can use the tools at the top of this screen in the first screenshot to filter and search for specific SPA packages. I want to be clear that these screenshots were generated in a test environment. These are not real Iowa SPAs represented in the screenshots. To access a particular SPA package, you would click the blue link for it that you can see in the first screenshot. To actually make, oh, you went ahead of me too fast, Ford. Can you go back one? Thank you. To actually make changes to a SPA package, you would click the blue Modify Package button that's near the top right corner of the next screenshot, the second screenshot on this slide. Okay, Ford, now we can go forward. Most eligibility SPAs are submitted to MacPro, including those affecting all the mandatory and optional eligibility groups, the financial methodologies used to determine eligibility, the income and resource standards used to determine eligibility, and presumptive eligibility. So this means that most of the SPAs that would have previously included pages from Section 2, Attachments 2.2a or 2.6a in the paper state plan, or A1 through A3, or any MAGI page in MMDL are now submitted using the corresponding MacPro RUs through the MacPro system. One exception that I want to make clear, although the tribal consultation process is described in the administrative section of the state plan, there is no tribal consultation RU in MacPro. So SPAs that affect the tribal consultation process should be submitted through OneMac. So we know that this question of what SPAs are submitted through what system and what MacPro RUs are available is a complicated one that can be hard to answer. So CMS published 2 crosswalk documents that are useful tools to understand which eligibility sections are included in the different MacPro RUs, what parts of the paper state plan they correspond to, and which eligibility sections are still submitted using the paper-based pages. So you can see from the links on this slide that there's a crosswalk from MacPro to the paper-based state plan and MMDL. And then the second crosswalk goes the other way from the paper-based state plan to MacPro and MMDL. Some RUs are available in MacPro, but not listed in the crosswalk documents that we just described. Those RUs include the 12-month postpartum continuous eligibility and former foster care RUs. So Ford is showing us the crosswalk from MacPro to the paper-based state plan and MMDL. And we're going to walk through a hypothetical example of how to use the crosswalk document. So in this example, we're going to say that a state wants to change their state plan regarding eligibility for people receiving hospice care. In the paper state plan, this information is on attachment 2.2a, section B. So in the crosswalk, we scroll through the document looking for attachment 2.2a in the first column. Oh, I think we might have here the crosswalk, the other crosswalk from the, I think we want the other one, Ford. Do you have it handy?
I am pulling it up now. Give us 1 second.
Everybody, bear with us 1 minute.
Is that it?
If we start scrolling down, yes, that's the one we want. Okay.
There you go.
Back on track. So as I was saying, we're looking for information on people receiving hospice care, eligibility for people in the hospice group. So we would start scrolling through this document, looking for attachment 2.2a in the first column. And there it is. Ford has found it for us. So once we find attachment 2.2a, we start looking for section B in the second column. And there it is. So once we find section B, we start looking at the third column for references to the hospice eligibility group. And we eventually find it in the second row on page 9. There it is. So now that we found the right row in the crosswalk document, we can look at the last two columns and see that there is no MMDL template for this eligibility group, but there is a MACPRO RU for it, the one called Individuals Receiving Hospice. So we can conclude that this SPA would have to be submitted through MACPRO using that hospice RU. The last thing I'll say on this slide is just that CMS eligibility subject matter experts are available to provide technical assistance on questions about MACPRO SPAs or any other technical assistance questions you might have about eligibility SPAs. And please don't hesitate to ask. We would much rather answer some questions and help you guys get your SPAs submitted right the first time than have things go wrong and then have to be corrected. So we can go forward to the next slide, Ford. The last thing I'm going to cover today is the types of eligibility SPAs not submitted to MACPRO. So the first group on this slide lists the types of eligibility SPAs that should be submitted through one MAC. They include post-eligibility treatment of income, or PETI, third-party liability, or TPL, express lane eligibility, and cost sharing and premium elections and methodologies, as we've discussed earlier in the presentation today. There is one type of eligibility SPA that should be submitted through MMDL, and that's the SPAs regarding assurances of compliance with limits on cost sharing and premiums. And also on this slide, you can see in parentheses the general location of these types of SPAs in the paper-based state plan. And I believe that brings me to the end of my section, and I'm going to hand it back to Karen to take us through to the end.
Thank you, Michaela. One MAC is a submission portal for paper-based SPAs and formal RAI responses for one MAC submissions and MMDL SPAs. You can also withdraw RAI responses and one MAC submission packages via the one MAC system and MMDL RAI responses. All other form of communications for one MAC SPAs are still conducted via email to the CMCS point of contact. Information about one MAC submission processes, onboarding materials, and help desk information are available in the FAQ tab on the one MAC site. You do not need to log into the system to access this information. One MAC is still a new system, and we are actively working to make improvements by adding new functionality. Be sure to watch for one MAC emails that announce new system updates as they are introduced into the production environment. As you can see, the one MAC system has only two roles for state staff. The first role is the state submitter. This role allows for creation of a paper-based SPA, submit SPA packages, and submit official RAI responses for CMS review for Medicaid SPAs, B and C waivers. New features recently added is where states can withdraw RAI responses and SPA packages via the one MAC system. The second role is the state administrator. This role can review and act on state submitter role requests and perform all the tasks that a state submitter can do. Currently in one MAC, you can submit a new SPA, reply to RAIs, once again for both one MAC and MMDL SPAs, withdraw formal RAI responses, which will take a SPA back off the clock, and withdraw a submitted one MAC package, which will remove the SPA from CMS review. Remember that responses to informal questions are not submitted through one MAC, but are emailed directly to the SPA CPOC. Now, we'll show you what one MAC actually looks like. We're using a test environment for the purposes of this presentation today, but it'll look just like the live one MAC system. You need to have a login and password to access one MAC. You can use the registration button near the top right corner to get to the CMS IDM login screen. If you already have a one MAC login, use the login button near the top right corner. This will take you to the login screen. If you are new to one MAC, use the red button that says New User Registration to establish your user credentials. If you need help with getting an IDM user login set up, contact your state lead. If you already have a OneMac login, input your username and password and click the checkbox to agree to the terms and conditions. If you forget to click the term and conditions, you'll not be able to log in and have to start the process all over. Another great feature regarding OneMac is that you use your EUA credentials for accessing the system, which means there's not another ID or password to keep track of. After logging in, the next screen you'll see is your dashboard. It shows a list of the existing submissions for your state. From the dashboard, you can use the tools on the right side of the screen to filter the submissions, making it easier to find a particular submission. You can filter by type, status, or date range. From your dashboard, you can also take an action for a particular submitted package using the action buttons, the one at the right of the screen that looks like 3 vertical dots. Clicking on any SPA listed on your dashboard will result in a screen like this with details about that selected SPA. If you're not sure who the CPOC and/or review team members are for a particular SPA, you can find the information on this screen. From your dashboard, you can also use the new submission button to create a new SPA submission. Look for it near the upper right-hand corner of the screen. You can reference slide 49 to locate the submission button. Clicking it takes you to a choice between submitting a SPA or a waiver action. Today, we're choosing to submit a SPA. This screen asks you to choose whether you are submitting a new Medicaid SPA or a new CHIP SPA. Today, we're going to submit a new Medicaid SPA. Be sure you're selecting the correct SPA type for your submission. The screen asks you to select the type of Medicaid SPA you're submitting. An eligibility, enrollment, administration, or health home SPA, an ABP or cost sharing, or other Medicaid SPA submission. Selecting either the first 2 options will redirect you to the appropriate submission system for those SPA types. For OneMac, you will use all other submissions or the 3rd SPA type. On the following screen, you will input the SPA ID and proposed effective date and attach all needed documents, which we discussed earlier in this presentation. There's also a text box not pictured where you can add any additional information you want CMS to know about the SPA you're submitting. The final step is to hit the Submit button, which formally submits the SPA to CMS. For SPA submitted via OneMac or MMDL, for which an RAI has been issued, you will have 2 options to submit a response. We'll cover this on the next slide. MMDL SPAs are submitted via OneMac MMDL RAIs are submitted to OneMac as there's no mechanism to reply to an RAI via MMDL. All MMDL SPAs will have a record in OneMac so states can submit their RAI responses via OneMac. Once the RAI response is submitted via OneMac, the state should submit the MMDL record back to CMS for reviewing. Submitting RAI responses is very similar to submitting a new package. However, you will submit the RAI in the package that has already been created. There are 2 options for submitting formal RAIs. Option 1, for submitted a formal RAI response to CMS, it is to select the link for the SPA from your dashboard. On the package details screen, select Respond to RAI from the Package Action section. The top box demonstrates this action. Be sure you're wanting to place the SPA back on the clock when selecting this action. If you want to work in draft with CMS before formally replying to the RAI, you'll need to work via email until you're ready to place the SPA back on the clock. Option 2, on your dashboard, click the action buttons to the right of the SPA link you are responding to. Then select Respond to REI. The second box demonstrates this action. Again, be sure you're wanting to place the SPA back on the clock when selecting this action. If you'd like to work in draft with CMS before applying to the REI, you will need to work via email until ready to place the SPA back on the clock. To withdraw a formal REI response in OneMac, you'll need to be sure to let your CPOC know. The CPOC will log into OneMac and enable the withdraw REI response. Once the CPOC has completed this step, the status in the dashboard will indicate the REI withdrawal function has been enabled. Once this occurs, the state can withdraw their REI response, which stops the 90-day clock review. Please note that the status column currently indicates the SPA is both under review and that the withdraw formal REI response feature has been enabled. Once the withdraw REI response feature is enabled, there will be two ways to withdraw the REI. Option 1 is to use the action buttons on the dashboard and then select Withdraw Formal REI Response. Option 2 is to select the link to the SPA on your dashboard and then select Withdraw Formal REI Response from Package Actions. Withdrawing a formal response to the REI makes it as if the REI response has never been submitted. You will receive the above message. Be sure this is the correct action to be taken. The SPA goes back off the clock and the review team and the states continue to work informally off the clock to resolve the REI questions. Sometimes it is determined that a SPA did not need to be submitted or the entire package needs to be withdrawn. The steps to withdraw a SPA package in OneMac are similar to submitting a REI response. Option 1, click the link to the SPA on your dashboard or select Withdraw Package from the Package Action area. Option 2, click the Actions buttons for the SPA on your dashboard and select Withdraw Package. Be sure that the intent is to withdraw the SPA package itself. Once the SPA package has been withdrawn, all review of the SPA ceases. Once this action is taken, there's no mechanism to reverse the action in the system, so double and triple check that is the correct action to be taken. Remember that withdrawing a package stops all processing of the SPA. You will receive this message to ensure this is the correct action to be taken. If the SPA pages are going to be submitted as part of a new SPA, that new SPA would need to be submitted by the end of the quarter to protect the original submission date. When I refer to the SPA needs to be submitted by the end of the quarter to protect your original submission date, that means the SPA will need to be submitted by the end of the quarter that the original SPA was submitted in order to protect a retrospective effective date. We also want to highlight the FAQ screen. It has answers to lots of basic questions and linked to resources such as the state user guides. The FAQ screen also shows contact information for the OneMac help desk. The next slide has links to all the three systems, OneMac, Mac Pro, and MMDL, as well as linked to their system resources. Okay, there is a lot of really useful information available on Medicaid.gov. We put links to several useful documents on this slide and also want to highlight the following parts of the website. Medicaid.gov was recently revamped how the information is displayed on the screen. The dark blue strip has headers that can be clicked on. From headers, a box will appear with topics contained within the sections of the website. For example, federal policy. This is where you can find SMD, show letters, SIBs, and other CMS guidance documents. Resources for States presents a link to SPA and waiver processing. This is where you can find many of the same links in this slide deck, plus other useful resources on reimbursement and specific type of SPAs. Be sure to check out the Medicaid SPA Toolkit available through this link. Other resources for states also present a link to the Medicaid and CHIP program portal. Medicaid and CHIP program portal is where you can find links to access OneMac, MacPro, MMDL, and other CMS systems, as well as lots of training and reference material on getting access to and actually using the systems. Medicaid has lots of policy information arranged by subject area, plus approved SPAs under the Medicaid State Plan Amendments. We encourage everyone to bookmark the Medicaid.gov pages that are relevant to your job duties for easy reference. This chart shows where the CPOC sits in CMCS for the most common type of SPA submitted. If you don't know who the CPOC for a particular SPA is, it's always okay to ask your state lead. And finally, this is a glossary of all the terms used in the SPA universe. We're now ready to take questions that you may have. Due to the size of the group, you may want to use the Zoom hand raise feature. The CMS team will monitor all participants for the hand raise. This will allow everyone a chance to ask their questions. You can also type your question in the chat and we will read the questions and provide a response. Okay. Let's see here. We've had several questions going on via the chat boxes and the Q&A section. So let us just get to where we can start. One of our first questions is, how do the RUs replace the previous SPA pages in section 2 and any of its attachments? Once the RU is approved, how does CMS want the state to handle the superseded information? We leave that process up to our state partners. We can share with you what CMS is undertaking as a way of updating for the reviewable units that are approved in MacPro. If Ford can go back to the crosswalk, we will share with you how we're proceeding to it.
You want the crosswalk itself or the slide with the crosswalk, Karen?
The crosswalk itself, Ford, if possible.
Well, let's see what we can do for you.
Okay. As you guys remember, while Ford's pulling that up, you can see that it has the attachment listed on the page. It has the paper-based section of the state plan listed. It also has the MMDL section and the MacPro section. What CMS is doing for our version of the state plans, and we're undertaking this project now, is we are looking for the RU that was approved in the state plan. So we can say something like qualified Medicare beneficiaries. If you do a controlled F, well, Ford's got one right there on the first page, but if it wasn't on the first page, you can always do a control F and type in the term. And from there, you look for the RU in the right-hand column. Now we're going to work backwards. We have qualified Medicare beneficiaries. We come across and it tells us that MMDL, there are no MAGI or SPA pages related to qualified Medicare beneficiaries. If we come back to the paper-based state plan, what is telling us here that it's in section 2, B2. And it gives us the verbiage in the Medicaid state plan. So what we're doing in CMS is we're redacting that off the paper-based pages. I can share with you that qualified Medicare beneficiaries are located several places throughout this crosswalk page. And what we do is we go to those MacPro unit and go to every place where qualified beneficiaries are under the MacPro RU name. And we do the back step and we look for the section and the subsection and redact that off of the state plan. Now, how the states choose to do that, we leave that up to you because you guys are in the best position to know how your state can handle this process. So We have had several questions in the chat. I don't know, Michaela
So Karen,
or someone, if we want to read them.
I think most of the questions in the chat have been answered. There is one that was just entered. This person would like to know, how early can a state submit its SPA prior to its effective date?
Okay. There is no guidelines that state how early a state can do it. If you're looking at a SPA that's going to be effective next year, we've seen states submit them. But I will share with you one drawback that we've also seen from SPAs being submitted too far to where the effective date is too far in the future. And that is, as they get closer to that SPA, something may happen legislatively within the state that may change that SPA being effective. An example would be several years ago, I worked with a state where they were adding something to do with a benefit to their state plan. They kept moving it out into the future, and they eventually had to remove it because they could not get funding for the benefit. So you always want to make sure that it's going to happen. And it's not unusual to have SPA submitted anywhere from 3 to 6 months to possibly a year before the effective date.
Thank you, Karen. We have a few questions in the Q&A. First one is, if a SPA is submitted to CMS, if a SPA is submitted to CMS and we receive an RAI, I understand CMS will provide a due date for the state to respond to the questions. If we need additional time, will this be allowed?
Okay, if nobody's going to jump in on that. CMS issued guidance via a SIB 3 or 4 years ago that where we asked that an RAI response be provided within 90 days. Well, if you cannot respond or work out all of the issues identified in the RAI within 90 days, as long as you're communicating and working with CMS where we can document that we're working together, we will keep the SPA on RAI until we come to a final disposition, and the state can then resubmit the response and CMS will move forward with that final disposition from that point.
Thank you, Karen. There is an additional question in the Q&A. I'm not 100% certain that we have the right people to answer this one, but I'll go ahead and read it off. For the Medicaid standard funding questions, I noticed that there is a question regarding the clinic or outpatient UPL, but it does not reference the inpatient UPL. If an amendment to 4.19A is submitted, should the question be changed to inpatient?
Michaela, I can do a general response for that. I want to remind states that there are 2 different sets of funding questions. There are funding questions for 4.19A and D. Those are our inpatient sections of the state plan. And there are funding questions for those specifically. And there's also funding questions for 4.19B as in boy, as these are our non-institutional funding questions. These funding questions, I believe, are available out on Medicaid.gov, so you can check there to see. And if you're ever in doubt, your DRR contact would be the best person to ask that question of.
Okay, thank you. I don't see any other questions that have not been answered in the chat or the Q&A. If anybody wants to raise their hand, we'll call on you and you can ask a question verbally, or we can just hang on a few minutes and see if any more questions turn up in either the chat or the Q&A.
Michaela, we got a comment on the MMDL slide about they couldn't see that particular slide. We will work on that for the next training and have that slide a little bigger and more clear for the group to see. Thank you for that comment. We appreciate you.
Yes. So I don't see any more questions appearing in either of the visual mediums. we might just hang on maybe one more minute and see if any more appear or if anyone wants to raise their hand and ask a question out loud.
Michaela, we just had a question on, is this located somewhere? Could Christina please verify what she means by located? Are you talking about the funding question?
Yeah, so so I went to that link that was provided earlier, and it has like the payment SPA tools and stuff, and there's a Medicaid funding questions, but that's where it only takes you to that one sheet. It doesn't give you an option for the Medicaid funding questions for the 419A or the 419B. So I didn't know if it was located somewhere else besides that link.
Yeah, it used to be under financial management. If it's not there, Christina, please reach out to your DRR contact that you work with on reimbursement only SPAs.
Okay.
And we'll also see if we can find the question to this ourselves, and we're working on some FAQ for SPAs that we'll make available. So just keep checking back.
We got an additional question that says, for mandatory SPAs, is the governor's review required?
Okay, I'll answer that one too. That is determined by the state, whatever your internal process is for the states. Some of our state partners, all SPAs are required for government review. Some of our state partners, only specific ones, and then others that that has been delegated to a specific unit within the state. So that is something you need to check with how your state has set up for that process.
Thank you, Karen. Thank you for answering all these questions today. You're the star of our team today. I do see another question. I think it was directed just to me in the chat, but I'll go ahead and read it out loud. Once a MacPro SPA has been submitted, the only way to use the modify feature is to have the SPA released by CMS, correct? And there's a second part. Is there any way to access the templates without having to log in to MacPro? I'm assuming that means the RUs. Is there a way to access the RUs without having to log in? Oh, Karen, you're on mute.
Michaela. Okay, the first question, is there any way to modify a SPA once it's been submitted to CMS? The way the system is set up is once the package is submitted, it is locked for CMS review. And when we unlock it and send it back to the state, that is the time that the modify action is enabled. And for the second part, I'm sorry, Michaela, I forgot what it said.
It was, is there a way to access the templates, which I think means RUs, without having to log into MacPro?
Unfortunately for MacPro, there's no way to access the reviewable units without logging into MacPro and starting your package. Now remember, you can start your package and save it and go back into the package later and use the modify feature button then, but just know that once you submit the package officially to CMS, the only time you can modify it is once we send the package back to the state.
I see there's another question that has just been put in the chat. Just wanting to verify if the person asking has the correct link for the standard funding questions. So I'm clicking on it. I think it's not an incorrect link, but we can probably get you a more specific one. Hang on just a minute and I'll try and find the link that goes directly to the SFQs and put it in the chat. And there's actually another question that has just been put in the chat, asking for Carrie to please reference again the types of SPAs that don't typically require public notice. There's a few parts to this, so let's handle that one first. Can we reference again the types of SPAs that don't typically require public notice? see Ford trying to get back to the correct slide.
I could take this one. So I think it's a little easier to tell you the ones that require public notice. So there are 3 types that require public notice. Those are the SPAs that modify any of the reimbursement that is in the state plan or establishes any new reimbursement for any benefits or services. And then there's 2 other types. There's public notice required for the alternative benefit plan, ABP SPAs. And then there's public notice required for the Medicaid premium and cost sharing SPA. So yeah, go back, that screen tells you the 3 that require it. So everything that falls outside of this 3 categories does not require public notice.
Okay. And the second part to that question was asking for Gilson to please share the SPA mailbox where states should provide withdrawal notices. And should that mailbox be used regardless of what system the SPA was submitted through?
Yes, that email address is SPA at cms.hhs.gov. That email will be sent to that address and to your CPOC as well, which would usually be your state lead.
We will add that to the slides. That is not on the slide presentation. We'll add that on one of the slides. Thank you.
And then the second part of that question was, should the mailbox, the SPA mailbox, be used regardless of what system the SPA was submitted through? So it's never going to hurt anything to send an email to the SPA mailbox stating that you want to withdraw a particular SPA. I don't know if I can recall offhand which of our submission systems include functionality to withdraw a SPA. Do any of my teammates know that answer right off the top of your head?
Michaela, all 3 systems has functionality to withdraw a SPA package. They could send an email to the mailbox. However, it will not be considered officially withdrawn until it's done via the appropriate system.
Thank you, Karen. Okay, and I did put in the chat the link that leads directly to the standard funding questions, as well as the SPA mailbox that Gilson just described for us. We still have some time, so if you guys have more questions, please keep them coming. We'll hang on just a minute to see if there's some questions that are brewing in anyone's minds. It seems like we may have come to the end. Okay. Well, not seeing any more questions through any of the mediums, I want to thank everyone for joining us today. We appreciate you all taking the time and giving us your attention for these couple of hours. We hope this information has been helpful. We always welcome feedback on these trainings. We, of course, want to make them as best as they can possibly be. So if you do have any feedback, I think everyone probably has Karen's email address since she sent out the appointment, or you can always reach out to your state leads as well. They know how to get in touch with the team that does this training. So we do repeat this training quarterly and it is posted online. We'll get the updated version available as soon as we can. But I think for today, we can say thanks again and everybody have a great afternoon.